Hey there, friends, and welcome to Lunchtime Live with the Center, where we talk about important fertility-related topics to inform and support your journey. My name is Ami Choksi, and I'm your host. Now, dealing with fertility issues can be hard. It is hard. It's nothing we expect to have to deal with, and it's not like we grow up knowing how to handle them. So sometimes we need a helping hand. And today, Dr. Kim Crone, our licensed psychologist here at the center, is here to talk about how to deal with the stress of infertility and getting through these tough times, especially with COVID and the holidays coming up. Dr. Crone, welcome, and thank you for being here.
Thanks so much for asking me, Ami.
Well, so Dr. Crone, who do you typically see and in your practice or in the practice, and what types of things do they come to you for?
So a lot of what I do here at the center is evaluations and consultations for third-party reproduction. So that's a lot of my time. But I also see patients for therapy. And the patients that come to me, I would say the primary issues are decision-making about treatment, whether or not to continue or how far to go. We talk about a lot of feelings of loneliness, isolation, feeling like they don't have quite the support that they'd love to have from people in their lives. Maybe that's because they haven't shared with those people, or maybe that's because those people aren't helping in the right ways. We talk about grief if they've had a loss, or just grief about going through this process. As you said, nobody expects to, be a patient here. And when you're here, it can take a lot out of you in terms of your emotions, your energies, your resources, and people need to sometimes talk through that and talk through the grief related to that, and the fact that this isn't going the way they ever expected it to.
Right. Do you see women or couples?
I mostly see women. I occasionally see couples. I often leave it flexible. So my individual patients are typically women, but I always say, if you'd like to, bring your partner or your spouse to join us anytime, I'm happy to do that, because sometimes it just helps for the significant other to be sitting there and listening to the conversation and participating and hearing about ways they might be able to support the patient.
So if the woman is the patient, do you ever see her partner? Is that something that you would do too?
You mean the partner separately?
Yes.
I would. I rarely do. I've done that on occasion, in addition to therapy that I'm doing with them as a couple. But no, usually I have an identified patient, and that's who I see, most of the time. And it's rare that I would see a partner instead of the female who's actually being treated here.
Okay. And what types of decisions do you talk to them about, or how do you help them work through a decision that they're having a tough time with?
Well, we really weigh what their priorities are, and help them evaluate what's most important to them, what their ultimate goal is. Sometimes our patients get so wrapped up in the challenge of treatment that they don't always sit back and really think, okay, how much do I really want the end game here? And for so many of them, most of them, the ultimate goal is to conceive and have a child, of course. But sometimes they realize during the process that maybe that's not what's so important to them, and that there are other things that they can find meaning in and purpose in and value in their lives. And we've really talked through what are the factors that go into that decision making, and how they can best and most genuinely decide what's right for them, so that they don't just get on the hamster wheel of treatment cycle after cycle without really evaluating what's most important to them. And sometimes to get to that end goal, it's considering third-party reproduction. So the decisions about whether or not they're open to that, if that's right for their family, and figure out again what seems like the most genuine, real, meaningful path for them.
You talk a little bit about the hamster wheel, and sometimes when women who are dealing with this, that's kind of how their mind races in like this constant spiral and hamster wheel of thinking. How are you able to calm that down, in effect, and so that it can help people to think in a more, I mean, to feel more in control of their thinking.
Yeah, I mean, that's sometimes a big issue for our patients because they do get so wrapped up in, okay, what's next? What's next? And again, encouraging them to sit back and evaluate the emotions that they're putting themselves through, and how to control those emotions can be really important. So I'm a cognitive behaviorist. So what that means is I believe that the way we perceive the things that happen in our lives, um, the thoughts we have about those events in our lives affect the way we feel and the way we behave. So what I do is I help patients, first of all, notice what those emotions are they are feeling that sometimes feel a little bit out of control. We acknowledge those emotions, accept them, say, okay, I get it. Maybe it's anger or grief or sadness or hopelessness, or even good ones. We acknowledge those too. We like good emotions and happy emotions too. But we evaluate those, acknowledge those, and then we talk through ways to maybe think differently about what they're hearing, what they're being told, what they're going through, that can help tweak that emotional response a little bit. So things like, are they focusing only on the negatives in the situation? Did they just have a consultation with their reproductive endocrinologist and their doctor told them 5 things and 4 of them were positive and 1 might have been a little concerning? Are they only focusing on that concerning piece? Do they walk out of the building thinking only about that? And we talk about ways to try to stop that way of thinking, to try to reframe and focus more on the positives, accept the concerning, information, but also focus on the things that they did hear that were good. We talk about trying not to catastrophize. It's amazing how one bit of bad news, hearing that maybe your egg retrieval didn't go as well as you hoped, they didn't retrieve as many as you had hoped, and they automatically start thinking, well, that means the cycle is going to fail. And if the cycle fails, I'm never going to succeed with treatment, which means I'm never going to get pregnant, which means I'm never going to be a parent. And all of those, that vicious cycle gets you to the point of, really catastrophic thinking. So we focus on evaluating those thought patterns, which then can impact their emotional responses to those thoughts. And in addition to the thinking, we do some behavioral stuff. So meditation, relaxation training, mindfulness training, ways that they can interrupt that negative thought process by some behavior. So if maybe they walk out of the building, they get in their car, they're shaking, they're sad, they're tearing up, helping them, not only accept that as a real, response to whatever just happened in the building, but also realize that that doesn't have to take over their day. They can maybe do a little deep breathing in the car, a little bit of cognitive restructuring, and just feel better, able to use the resources they have in place to cope with the rest of their day and what they just heard about their treatment cycle.
So you offer them these techniques and these tools to help them do that even on their own.
Exactly. I mean, we talk about it in here, and I teach them these skills, and these skills take practice. They don't happen overnight, and then they practice by the time I see them next. Hopefully they practice. Not everybody does their homework, but we assign a little bit of homework to, identify a few occasions where they might need a little cognitive restructuring or a little behavioral intervention, and they practice those, and hopefully when I see them next, they feel like they've gained a new skill to use. And the more they practice, the more comfortable they're going to get, the less thinking they have to do about it. It just becomes more automatic.
When should someone come see you? So aside from, working towards a specific goal like third-party reproduction, what about, when would someone know that they should come see you?
Well, I typically say that if the way they're feeling is impacting the rest of their life, so we know that infertility treatment is a roller coaster. You've got the ups and downs, the in-betweens. And for so many of our patients, they kind of they buy a ticket, they get on, they ride and they manage pretty well. But if their emotional response to what they're going through here is impacting their work or their relationships, or their own sense of self-worth so much that they're feeling like they're losing themselves, or they feel like they're just not feeling as good as they want to be feeling through this treatment, come talk to me about it. And I will admit I'm often full in terms of my therapy caseload, but there are some really wonderful therapists I can refer people to. All the nurses have that list of therapists that have a clue about infertility and what treatment is like. So if I'm full and can't take on a new patient, we do have other options for people. And my goal is always just to help patients feel better, and to just help them tolerate this experience as well as they can, so that they can persevere for as long as they can, and help them figure out how long that is.
Yeah, that's wonderful. We're coming to the holidays, or we're almost there. We're practically there.
Yeah.
How does dealing with fertility, how did the holidays impact dealing with?
Well, holidays are a tough time.
Yeah.
I don't need to tell you that. I don't need to tell our patients that. They know it. Oftentimes the holidays are coming up and they can't believe that it's been maybe another year that they've been in treatment, or that they haven't achieved their goal. They might have decided a year ago that they were absolutely going to do everything they could to be pregnant by the next holidays or have a baby by the next holidays, and to then be facing another one that hasn't happened can just be really sad. I mean, to simplify it. So I support patients in that for sure, but there are definitely ways to try to handle that a little bit better. One is to be careful about being on social media, especially around this time, seeing and Facebook and Instagram and all those things, seeing tons of pictures of your friends and relatives with their babies or families can be really hard. Oops, my light went off. Also trying to control, and the pandemic in a way helps a little bit, trying to control exposure that you have to other people that could be exacerbating any sadness or disappointment you have, or pressure that you feel. So everybody knows those family parties that people are asking, so when are you guys going to have a family, and when's this going to happen for you? And it just gets really old and really exhausting. And if even during this pandemic, you're faced with the decision about whether or not to go to some of those gatherings, I would say if you can, use the pandemic as an excuse not to. If you feel like it's something you can't avoid, really choose wisely about which ones you go to, and be very careful in terms of social distancing and wearing masks and all that stuff, but also be careful in terms of protecting yourself. So having a bit of an escape plan, decide how long, you're going to be there. Be prepared for people's questions. How are you going to respond if somebody does ask, when are you going to start a family? And it could be something as general as, we're working on it, or depending on how comfortable you are with that person, you can let them know it's been a tough year, and that it's, owe up to some of that pain, and say that, it's been tough, but we're still, we're plugging away. Be prepared for maybe just having to say, okay, I've kind of had enough, even if it's a Zoom call, even if it's something like that, being prepared to just say, okay, this is, gotta go. And that's okay. And people just have to understand. My other bit of advice is to be careful of those holiday cards. So we all get these holiday cards, maybe fewer this year, I don't know, we'll see. With these pictures on it that are just a reminder of things that you might be missing right now. And my piece of advice is to gather those up. Don't open them individually, just put them in a pile. If you feel like you have to open them all at once. Open them with your partner or with a friend who has an idea of what's going on, and celebrate when they're all done. Get through them, and then put them aside, and that's it. You don't need to put them up. You don't need constant reminders. You did your job. You looked at the cards, and that's a great thing.
Okay.
But it's tough. It's tough. And trying to give back, trying to find purpose and meaning at this time is kind of tough, but people are in need. And so doing something kind for somebody else, giving back in some way can help you feel like, okay, maybe I'm not fulfilling the purpose I really wanted to right now, but I can approximate.
Yeah. Well, it's interesting that you mentioned that there's a little bit of a silver lining with the pandemic being here, because you don't have to go to some of the holiday parties where nosy friends or family members are asking too many questions that really,
Yeah.
I mean, that they really go in, they, what am I trying to say? It's hard to set boundaries around it. So
Yeah.
is there a way to set boundaries when people ask you these nosy questions?
Well, it is amazing, and trying to and it surprises me all the time how people can be so nosy, and yet I have to catch myself sometimes. I even forget. So my first piece of my first suggestion there is to be graceful and generous in your attitude towards them. Realize it's not malicious. They're curious. They're wanting the best for you, and maybe it's just their way of letting them know that they're thinking of you, or really curious what's going on with you. So let's trying to be generous about it, but also seriously having a rehearsed response to that. Maybe trying to have a bit of a thick skin, but saying the same thing when every time somebody asks you that. It could be, like I said, as simple as, "Yep, that'd be fun. We're working on it," or "We'll keep you posted." By being pretty consistent and rather short, hopefully they will get the message that it's just not the time to talk about it. And it's trickier. The pandemic, we kind of joke that it's a little bit helpful, but in these Zoom gatherings, it's even tougher, because sometimes people put you on the spot, and then you've got this whole screen of people waiting to hear your answer. So again, rehearsing what you want to say, and rehearsing that with your partner so you guys are both consistent.
Is that something you do in your sessions? Do you ever rehearse with patients?
We role play sometimes if there's a particular relationship that one of my patients is struggling with. We role play that, and how to maybe handle some of the dynamics of that relationship in a way that they feel better about it, that they don't feel guilty about what they're saying, and that the other people hear.
Yeah.
Yeah.
Now, switching to relationships with your partner. Now, sometimes in male-female relationships, women become big planners around trying to conceive IVF cycles, whatever they can control, which is understandable. There's a lot at stake, but sometimes it feels like their partner may not be on board or understand all of this. How do you help your husband or your partner to understand what you're doing and dealing with?
Yeah, I mean, you are so right that the female is often the one being their own advocate and being the proactive ones in terms of, researching and making appointments and showing up for appointments, those kinds of things. And it can feel like the distance just starts growing and growing and getting bigger between the amount of time they're spending on this and the amount of time their partner is. And that can start to feel really lonely, and it feels like maybe your partner's not as invested, even if they are. It may be just that they don't have that opportunity, or they don't really even know what they can be doing to show support and show investment. So first and foremost, and it's kind of the answer to a lot of issues, and that is talk about it. Be open with them, owning your feelings about it, letting them know, those "I feel" statements go a long way. I feel alone in this process, or I feel like all the responsibility is on me, and that makes me feel pressured. And letting them know how much it would help you, or feel like they are involved and committed if maybe they made some of the phone calls, or maybe they did some of the research. or even if they can't take on that role, giving them other ways that they can help you, because probably, and I can't speak for everybody, but probably their partner is wanting so much to know what they can do to help, but they feel helpless in helping, because a lot of times they've tried something that hasn't gone so well, and everybody's emotions are kind of high, and it's just hard to know what's helpful. And communicating about that, letting them know what actually would be a supportive gesture to you. So whether it's making you dinner, making a phone call, doing a little bit of research online, hugging you if you get disappointing news, and not constantly trying to solve the problem, not constantly trying to say, oh, it'll be okay, we'll figure it out, but just listening to you and offering whatever support actually does help you. So what that means is, for the females typically, is figuring out what does help. Not expecting them to know and be able to read your mind. Even though they love you, they can't read your mind. So really thinking yourself what is going to be helpful and meaningful and supportive for you, and communicating that to them, and appreciating any attempt they make to doing that. So it could be that they do pick up the phone and try to make an appointment. But if they do that, and if they try their best and still mess it up, you need to thank them for trying, and let them know what might help better next time.
Okay, that's great.
But it's tough. It's stressful for couples. It really is.
And it seems like it takes a little practice in trying to, because in learning how to handle things and the techniques, it doesn't just happen overnight.
No, and I think people want it to happen overnight, and I wish it would, but no, it doesn't. And learning any of these techniques, whether it's relaxation and stress management, or communication skills, or really just personal insight as to what would be helpful for you. It's not an overnight kind of thing. So it does take thinking and practice.
One question that came up in one of the support groups that I run was this patient, her partner was dealing with male factor, and she asked, logically, how do I separate the emotional side that wants to blame him with the logical side of my brain that realizes that, this is not his fault, and I don't want to feel this way, but part of me does. How do you balance those two?
Yeah, that's a tough one, because it's really hard to not feel some of that blame, and even self-blame, in this process, which isn't fair either. And trying to remind yourself of the logical side, that this is not really his fault. Even if it's a male factor thing, it's nothing that he had anything to do with. It's not, he didn't, most likely, it's nothing he did that caused this. And remember, and again, this is where being generous in spirit, remember that if he could fix it, he would probably do anything he could to fix it. And he's probably already beating himself up and feeling some blame about that. So reminding yourself of that logic, and that focusing on the blame is just going to cast more of a wedge. So talking about it is okay. Letting them know that sometimes those thoughts creep up, and that you don't want them to, but you own them and you realize where it's coming from. But that, overall, that's not how you feel about them, and what they can do to help you feel like they're taking on some of the, not necessarily responsibility, but some of the feeling of burden and pressure of treatment, by helping any way that they can. But again, owning that emotion, and owning that thought, even though I would say reframe it if you can, focusing on what you do know logically, but realizing that the blame is part of this, it's part of this vicious cycle sometimes, and it's doing you no good, but sometimes it happens.
Okay. Do you what would you recommend, switching a little bit, for people who are going through this? How would someone else in their life, a parent, a sibling, anyone in their life, how would they support someone who is dealing with fertility? What's the best way? Sometimes they say things that are well-meaning but don't help.
Yeah.
Just relax. But what can they say? What are some things that they can do or say?
So the just relax one is so classic. And that one drives me bonkers because it's unfair. It's unfair to the patient, and it's not true. It helps. Relaxing helps for sure. Helps you be as good a patient as you could possibly be, but it's not going to be the magic bullet by any means. The things that they can say are typically, this is where the patient really needs to think about what helps them. Okay. So for some of our patients, they would prefer that maybe their mom doesn't say anything, but just listens and is, again, just a sounding board, doesn't offer advice. Maybe, if anything, just say, we can't imagine how hard that is. We're here for you. We love you. More than anything, just reminding them, just having the person in their lives, either their family member or their friend, just say, I care about you. I love you. I'm thinking of you and I want the best for you. But not constantly trying to offer advice, not constantly asking questions. Sometimes the best way they can help is to stop asking questions, to stop checking in. For some patients, they love the regular check-ins. For others, it just gets to be too much pressure, too much of a burden. They feel like they're constantly disappointing everybody. It gets to be too much. So sometimes it's asking questions. Sometimes it's giving the patient space and not checking in. It can be as simple as, being a cheerleader for them, reminding them that somehow, some way, they can be a parent, and maybe it's not going to be the journey they ever imagined. Maybe they're going to be bumps and hurdles along the way, but that's going to be their story, and that they believe in them and are hoping for the best for them, and absolutely, think this is the right thing. So many people say, like, oh, well, maybe it's not meant to be, or, maybe it's God's plan or something like that. That is just so not the case. And it can be so discouraging and just exhausting for our patients to hear that. So giving the people in their lives some advice about things that aren't helpful to say, again, they probably mean well, but it isn't helpful for them, is good. You need to train them, just like we talked about teaching our spouses and our partners what helps. You need to teach these other people about what helps, and figuring out before you have that conversation what is actually going to help.
That's great information. Do you also see patients who are already pregnant and dealing with anxiety around that, or who've had?
I do short term. Typically, it's a patient that I've been seeing throughout treatment, and they conceive, and then they're still, they give birth sometimes even, and are still having some anxiety. And I even see people up to that point. But yes, I meet with patients. I've done a lot of high risk pregnancy work in the past. So yeah, I see patients who are pregnant. We talk through how to deal with that anxiety, how to manage some of the stress, the pins and needles that they're going to feel. As infertility patients, it's really hard to ever feel confident, even after numerous tests and even ultrasounds. It's hard for them to believe this is actually happening, and we work through how to try to appreciate the good that's happening and the fact that things are going well.
That's wonderful and encouraging. So thank you for being here, by the way. How would someone make an appointment with you?
I'm sorry, I didn't hear that one, Ami.
Yeah, how would someone make an appointment with you?
Oh, okay. So to make an appointment with me, you would call my scheduling person, Dawn, and she is at extension 8014. She can let you know whether or not I'm taking new patients. If I'm not taking new patients, she'll give you a referral list. If you're in crisis, and I say this all the time, and I tell our doctors and nurses this too, that if they have a patient in crisis, I will absolutely figure out a way to at least have a phone call conversation with somebody. So if you call Dawn, she says, I'm full, she can't get you in to see me for a long time. Oops, my lights again. and you let her know that you're just having a really tough time, you can always, she'll give you my phone number that they can reach me directly, because I want to make sure patients get support in crisis moments if they need it.
Oh, that's great. Okay. Well, thank you
So,
again for being here. Now, along with individual counseling, we also offer group support through the center as well as through Resolve New England. So if you are having a tough time, there's some additional resources to tap into, as well as, like you said, Dr. Crone, about we have a list of other psychologists that we work with as well. So this is the last Lunchtime Live for 2020, but there are still events coming up, including a support group as well as yoga. So check out our website at yukonfertility.com for details. Wishing you guys a very healthy and happy holidays, and we will see you next year. Bye for now.
Bye.